So that was a brief overview of the ACIST system, including the mounting, the setup, and the operation of the system. And now I'd like to cover some frequently asked questions by the operators.
I don't seem to be saving any contrast. Why am I using more?
That's a very common question among new users of the ACIST system. And generally, the cause of that is their operation of the hand controller. Okay, usually they are convinced that they have to use a larger than what we expect to be normal amount to still get a good image. Remember that these are the maximum limits on here, so this is as much as you're able to deliver. Another important way to save contrast with the system is to be liberal with your purges, especially the initial setup purges of the system.
Hand controller does not seem to be working properly. I'm not able to calibrate it.
One of the more common questions with the hand controller is no response. Typically it's very simple. Usually it's just the hand controller connections that are located underneath the screen. Okay, the system would also need to be calibrated to their touch as well too, which again is initiated by the bottom center button on the screen.
I'm using a 4 French catheter, and when I select the left coronary artery and try to inject, the tip of the catheter slips out of the artery.
That's also a typical new user question where they may be more comfortable with mashing down on the button, as we say, when really it is more effective to provide a linear flow. So we like to kind of, what we say, ease into the injection rather than pressing down as hard as we can the button. That will enable the contrast to be delivered from the catheter tip without it ejecting from the artery.
How do I go about clearing air out of the high pressure tubing?
Clearing air from the high pressure tubing, the system will actually prompt you, if you arm to inject and it will say air column detect, the message on the screen is to turn the stopcock off to the patient and press purge. So the physician would do that by selecting purge on the screen and then tubing. Again, one more reminder to turn the stopcock off to the patient, and then a generous purge to allow the air to be removed from the side port of the stopcock.
I keep getting a air column detector warning, and there's no air in the tubing.
Air column detector warnings are not an error message, it's an informational message. Sometimes it's as simple as the contrast tubing is not clipped into the sensor properly, and sometimes it may be the strain relief is also not engaged to prevent any false tugging on the sensor.
The tubing is moving in the peristaltic pump. Why is that?
The peristaltic pump roller assembly is designed to accommodate different size tubings. Our saline tubing is a standard size, and so the guide teeth on the peristaltic pump should always be in the down position and locked. If that's not done, it's not pinching the tubing hard enough and allows the tubing to walk through the system, as we say. Ensure that those black tubing guides are in the down position and the latch is fully closed.
There seems to be something wrong with the touch screen. Either the command does not work or the touch screen is not responding correctly.
If the touchscreen is not responding correctly, the very first thing to check is to verify that the standby switch is not engaged. When the standby is engaged, this disables the screen, and so nothing on the screen can be activated. The other factor that can affect the screen responsiveness is the calibration. This needs to be done with a completely clean screen with no contrast on here and being very accurate as we touch the 3 crosshairs during the calibration mode of the system. If this is done, the screen should respond appropriately for every touch.